an indwelling catheter, the urine's really gunky and cloudy, and so after 4 attempts they finally get a specimen. You see what the urine analysis and the lab test showed. So now the patient's in the emergency room. Day 1, her procalcitonin is 0.05. Blood pressure is normal. They put her on ceftriaxone. The next day, her blood pressure drops. He's probably thinking urosepsis. Procalcitonin is still normal at 0.05, but look where the lactate is. It's 2.7. So now this therapy gets changed to piperacillin, tazo, and tobramycin. Now, later in the day, blood pressure is still low. Procalcitonin is still normal, but now her lactate's at 4.3. But now they add vancomycin to the mixture. So at this point, that's when the PharmD intervened and said something else is going on. You know, her procalcitonin has been normal, but you know, there's some hypoperfusion and the lactate's going up. So at that point, they ordered a troponin. Came back 1.51. So it turned out the patient had a STEMI and had to have two stents. So, you know, as I had mentioned earlier, the markers are complementary. One doesn't replace the other, and I think that this particular case study, you know, emphasizes that. So if you're seeing your procalcitonin is normal, but your lactate's going up, it's saying look for another etiology. So key takeaways, you know, you always have to use procalcitonin in clinical context to what's going on with your patient. You know, it does improve your probability that your diagnosis was correct. Serial measurements are important. You know, you want to do stat and then repeat in 24 to 48 hours. Don't rely just based on one level. I did get a call recently from a physician who started using procalcitonin. He didn't do initial levels. He made the decision, or the decision was made based on other diagnostic tests, that the patient had pneumonia. He wants to now discontinue antibiotics, and he said to me, okay, well, this is my procalcitonin level. Can I safely stop antibiotics? And, you know, it's like, well, what are the other levels? Well, we didn't do them. So you can't just base it on one level. You want to at least have 1 or 2 to make your decision. It has a good negative predictive value. It helps with your differential diagnosis, and it can be helpful to reduce overall antibiotic exposure, which will have an impact on the antibiotic-resistant patterns. So this was the spreadsheet that I was talking about that I can send to Anne and she could share with you. I don't bring copies because then you lose the value of the hyperlink. So the titles are all hyperlinked to either PubMed, because if I send you the article, then I have to report it because of the Sunshine Act, and if I send you a copy, then I violate copyright laws. So this gets around it in this way. It's not that you can't do the research, but you're busy in clinical practice. So that's what I typically update and prepare, and I'll send it off to Anne. And if you have any questions, I'd be more than happy to.
So I'm an outpatient. Can you look for me, 1, serial, so what's the cost of 1 test if we're doing serial tests? 2 is meningitis, things that I would see as the outpatient that I would use, viral versus bacterial early on, inflammatory bowel disease versus irritable bowel disease, and tick-borne illnesses around here. How long do you keep somebody on antibiotics for that?
Okay.
See if there's any of those things that can come out.
Okay. But yes, there is data in the literature on meningitis, aseptic versus bacterial, and when you need to order antibiotics.
Yeah,
As far as
that'd be great.
as far as the cost, because I don't get involved in the sale of the equipment or the assays.
Dave, well, that's me.
$1,900
So we also-
700 tests.
We also have Matt from Cheetah who can come talk to us as well for this time. Thank you very much. Dan.
Thank you.
That was
Thank you.
great. Thank you.
Thank you, Diane.
Sorry if I went a little bit over.
That's all right.
Like, we didn't warn you about this one, but questions are good. This is unusual, you know, smushing 2 into 1.
And now I've got reinforcements too.
That's right.
I don't know if I like this link.
As a teacher, I love questions.
Do you want me to introduce Matt? So there's just
Yes,
Matt
please.
Lyons from Cheetah.
Hey, everybody.
Yeah.